Welcome to Posture Podiatry. My name is Daniel Gibbs, here with a short video to give you some answers for your heel pain. Now, if you wake up in the morning and your heels are painful, or if you get painful heels after standing or walking for a while, you may have been diagnosed with a condition known as plantar fasciitis. But did you know that plantar fasciitis is misdiagnosed in up to 80% of cases? The term plantar fasciitis refers to inflammation or itis of the connective tissue, the fascia, that runs along or under the base of the foot, the plantar surface of the foot, and it usually is focused around the connection to the heel bone. Studies have shown that up to 30 times your body weight can be loaded through that plantar fascia with heavy impact, with the weakest point right there at the heel bone. Traditional conservative therapy for plantar fasciitis involves rest, managing the inflammation, taping and arch support for your feet to reduce the stress on the plantar fascia. Now, these treatments can work well when the problem's been correctly diagnosed, but they can also take a long time to see results. So if your heel pain has not responded to traditional therapy, there may be something else that's been missed. In most cases, you may not actually have plantar fasciitis at all. And this is because of the muscle and nerve interactions with the heel that may produce similar symptoms but require different treatment. This compels us to look further into the problem to discover what's really happening rather than taking a band-aid approach. So, in addition to inflammation management involving rest, ice, compression, elevation, anti-inflammatories, and the structural treatment, taping, bracing and supports, you may also benefit with what we refer to as functional management. That is, improving the ability for the foot to function correctly with manual therapy treatment directed at the muscles, the nerves, the joints and the ligaments around the area. This can often be the missing link for many people who are suffering with stubborn heel pain, and they can be very effective at addressing the true cause of the problem. The podiatrists at Posture Podiatry are trained to find these problems and maximise your foot's ability to function without pain. The result? No more hobbling around on painful heels, and that's something you can live with. Thanks for watching.